We will be talking about few cases, but the main focus I have kept is about what experience I have with skin conditions and where we share our difficulties, because I think skin conditions knowledge is, as far as information is concerned, would be adequate with people who come for PG home, and you're all already into some exposure to practice, so you would have seen the conditions which commonly we see as homeopaths. So I don't think the clinical data actually matters to any of us sitting in this auditorium. What really matters is how do you apply a very good homeopathy to solve these cases, because in all these cases something is there which makes a solution possible, and some things are there which come in the way of our solving these cases. Dermatology is one field which has earned a lot of reputation for our science. Homeopathy as a science, we have earned a lot of name because of skin conditions, and compared to that, even for conditions for which media talks about very highly about us, these are very cases which sometimes test our knowledge and they test out our patience. These are often the patients who actually leave us halfway, midway, sometimes with disappointment, sometimes partial relief. So though homeopathy has become famous, for curing skin conditions which are very, very difficult, these are often the cases which are not cured completely by us, often not by one homeopath. It like moves from one to another and all those things. Okay. So I was, when Dr. Amit telephoned me a few weeks back about this, I was just wondering what to share here which will be really useful. So I have not confined myself in any format. I would rather try to see what are ideas which I can talk with you. This was incidentally the thesis that I did for my MD a few years back. I titled it Fusion, because what I feel is that the best application of homeopathy is possible when we have a handshake with all good things which are friends with homeopathy. You make friends with the patient because he's going to do work with you. He's going to be 50% partner of your project actually. So shake hands with him. Similarly, shake hands with whatever is good in clinical medicine, because whatever is scientific and whatever is not going against you, you should make best utilization of. So this was one of the key factors with which we work with many cases. I work in rheumatology field for the last 20 years, and I've also been working with asthma and respiratory conditions like COPD and all for a little more over 22 years. And even amongst fever cases we were working on, and this was the common theme we found, that when we cracked whatever problems we were facing, there were some very, very similar ideas as far as concepts are concerned, and all the similar ideas we tried to combine in this approach which we call as fusion. So we'll start with very simple things, and I have not brought cases on PowerPoint or video. I have brought cases which I will narrate to you. Okay. I thought of these because often we do video cases, often we do PowerPoint presentations. In that I feel if you want to really wrestle with the issue and grasp something out of it, it is not done very well, especially if you just have 3 hours. Okay, if it is a series, a long whole day workshop or long seminar, a lot of time is available for all kind of interaction. So what I try to do is some concepts I put on the slides, cases I will narrate. Okay, I come from a little olden day learning style. When I passed out, I joined senior Dr. Dhavle, Dr. M.L. Dhavle, the author of Principle in Practice, and there was some pattern with which we used to learn in our afternoon sessions after the clinic was over. So I thought of reviving that for today, okay, so that we can really solve those cases together. Maybe we don't solve a long series. So I'll start with some ideas and then we go to main case and we solve it together here, right? Fine. So this is the first important message in that what we have to focus on. Every case, there is something actually we found out which is to be cured. What is written in our aphorism 3, See, every case doesn't have everything to be cured. There are some aspects which are to be left alone, there are some aspects which are only possible to palliate, there are some aspects with which patient is going to live, and something to be cured. And that what is to be cured has to be very, very highly specific and clear cut for us. This we found was one of the confuses our case management often. So the second aspect was that when you take a case, try and see what way you can receive his experience. See, this whole trouble with the finding right remedy is often occurring because we all are followers of some teacher or the other. Okay, I follow this school of thought and I follow that school of thought. I use this repertory and I use that software. I believe in this author. I like Shelton very much. I like Dr. Shankaran very much. I like this some other author. I like old authors only. All these things actually confuse us more. Focus on very simple thing on when you are taking the case. Don't remember any of these gods at all. Okay, just take the case. See, that patient is suffering because rather than being him, suppose say he is Sanjeev, rather than being Sanjeev, he is going through an experience which is different. He is going through an experience like some plant, he is going through an experience like some metal, he is going through an experience like some animal. So if we receive a case, our focus would be on what is the problem that he is going through, through data, through symptoms that he describes. Focus on that experience and catch it. I am not saying you bother about classifying those kingdoms also. I am using this example just to give you imagery. There is one within that man, okay, who is sick, which is ultimately a different experience than his health. If you catch that different experience and give it a totality, that will take you to the right remedy very well, and that will give the best result. So focus only on receiving case and then focus on making a totality. In these steps where you feel necessary, use somebody's work, that this repertoire is useful, take it, this approach is useful, take it. The data is very short, okay, remember Boger. Okay, here there are more modalities, remember Monigosen. Do like that. Don't become wholesale follower of anybody. Okay, Hahnemann himself went on developing his concept from law of similars. He started with law of similars, then he added on potentization, then he added on first single dose, then multiple dose, then 50 millisimilar. So it's a evolution. There are no separate pathways. Okay, and actually if you go to see all different pathways, they are all like different religions. Ultimately everybody wants to do what? Help a patient. Okay, so but it is like this, that in my flat showcase I would have sculptures, in your case showcase you might have glass things, and third person would have more paintings in his house. So I would show my sculptures, he will show his paintings. It doesn't mean that that's the only good thing which can make a hall very beautiful. Okay, so don't think that any one particular method is good. You rather focus on the basics of what we need to do and incorporate all good ideas into that method. Apart from this, the second important clue which we have found while solving all these cases was that it's very important to make a proper clinical diagnosis and connect your strategy to that. Actually, in relation to this, we found a renewed interest in the classification of disease. What Hahnemann has given is aphorism 71 onwards, what we learn in the second year onwards. Classification actually tells you strategies. So doing a very good diagnosis, connecting to the details and making a classification is very important for deciding all your management steps. It's a chronic disease, but right now at exacerbation, it will require a little different strategy. It's a chronic disease, it's gone worse, and that's why right now in an acute severe stage, it requires a different strategy. So we require to look at the observations very well in the clinical picture. Don't miss out anything, make a good diagnosis and connect so that you can classify the case well. The second is very important. You must observe very well, because small things decide everything, a lot. Most of the skin cases, at least half the skin cases, they look like eczema. Okay, just like in fields of joint, half the cases look like RA, whereas actually statistically RA cases are just 4% out of all the rheumatology cases. So similarly here also a lot of things look like eczema, but when you see details, you turn around, the details make it very different. So you have no escape from details, and you have got no escape from studying something in a very keen manner, right? So not just the diagnosis but the exact state, and if this is possible to get into, most of the case solving is not difficult. Your percentage of results can really change with just these two simple tips. We'll start with a small case. Now this we are not, I'm clarifying, this case we are not using as a case to whole case learning. We are just using as some examples to open up our mind windows. This is a patient who has come, he's got a thick area of skin lesion, again something looking like an eczema. Okay, He's got a thick area of lichenification on both the lower legs and feet. He has seen up till now 6 dermatologists in the last some 4.5 years or something. Okay, his trouble is very simple. Every day late evening after he finishes dinner,